sick role. When you talk of sick role, actually, basically you should know about sick role. It's there are two things. It's about the state of being sick and the sick role. When you talk of roles, roles is like.
Excuse me, doctor. You may help us put it in
yes.
presentation
Let
form.
me. Show slide.
Yes.
I think show slide.
Yes, yes.
Okay.
Okay.
Sick. One of the illness behaviors in health. But when you talk of roles, roles are basically expectation associated with status. But status is a position occupied. It's unstable. Are you getting me?
Yes, doctor, we get you.
Yes, we are getting you.
Hello.
Yes, we are getting you.
So just yeah. I shouldn't attend this lecture.
Now.
Hello.
We are hearing you, but not seeing the screen.
The network has disappeared. Let me look for another location. Maybe I move out of the room. I get another place. Give me like, I'm just going to carry the laptop in a few minutes to look for a better network position.
We are hearing you clearly, doctor. Please, guys, mute your things, phones and gadgets so that we get the doctor clearly. For the sake of everyone, please.
Hello.
Yes, doctor, we can hear you.
Are members getting me?
Yes, doctor, we are hearing you clearly.
Yeah, okay. Sick role.
We can't see
when
the
you talk
screen.
of Seeing the screen again.
You have to share the screen again when you go off.
Pardon. What if?
Okay, doctor.
Let me try it. Yeah, because
What if
let me just talk with you and then the record. I hope the recording person will be able to record.
Doctor, you can share with us your slides. Then we can share the screen. Then you'll be talking.
I said, okay. But it will take really.
we are seeing very well?
We are now seeing.
Yeah, you are seeing.
We can be able to see so just so clearly. You can see.
Let me, what we do, let me just lecture, then I will send you people the handouts to right now in a few minutes. You don't mind of, because there are 4 major things you have to know in about this sick role theory. It's not something very big. So you bear with me like the way it is, and we'll manage to finish. Otherwise, we'll not be in position to finish. So long as the person who is recording is able to record me, I think would be good. Is the recorder able to record?
Yes, doctor, we are recording.
Then let me share, and then you can share the recording with you can share the recordings with your colleagues.
We're even seeing the slide, doctor. It's okay, you can continue with the lecture.
Yeah, now see.
Yes, doctor.
I hope it won't disappear. Okay. I hope it won't the network won't disturb us again, because sick role theory, this is a theory which it has 2 major concepts: the sick role and the roles and the state of being sick. When we talk of roles, those are expectation associated with a particular status. For instance, your role is your status is a student. As a student, I expect you like to attend a lecture. I gave an example here. For example, an university instructor, I am expected to come to class on time, teach the subject matter, that is sociology and anthropology. I'm not expected to walk in late or not show up at all, nor am I expected to answer questions which are related to physics. As a student, can also be like a pattern of the pattern of response to a particular persons whom an individual interact with. Then also we have the different types of roles. We have the impaired roles. We have impaired roles, the roles displayed by a person who is disabled or chronically ill, or who is experiencing state of wellness or realization of potential commensurate of the condition. Unlike the sick person, an impaired person cannot be expected to want to get better, but expected to resume normal duties as possible. And then we have role conflicts. Role conflicts, when we talk of role conflicts, it's a set of expectation. Normally people always say role conflicts is when there is a definition which students often say, but role conflicts is when different roles conflict with one another. But most students always say maybe when in role conflicts, when people like 2 different people conflict. But role conflict is more of within one person. For instance, as a student, you are a student, and I heard in the background, you are a student and a babysitter at home. That is what I call a role conflict, what was taking place in the background. I hope you are trying to get that example very clearly. Someone is expected to attend a lecture, at the same time is expected to be what? To take care of a baby. So that's one of an example of a role conflict. For example, a working father with a sick child. The best example could be a working mother. You know, for us men, we don't focus much on children. A working mother with a sick child, the expectation of the worker that they should go for work, and the expectation of the mother is what? To take care of that sick child. That is the what? That's the conflict. So the expectation of the role of the worker's role and the expectation of the father's role tend to conflict with one another. So that is what we call what? Role conflict. For instance, you are a student, at the same time, maybe a student, at the same time, you are the student leader. The student leader, at the same time, you are a parent. So all these different roles tend to conflict. Are you getting me well?
Yes, we are getting you, doctor.
Yeah, I was giving an example of a student who is a student. For instance, you are the student guild president, like a student guild president, you are expected to attend the guild meeting. At the same time, there is a lecture. And if you're a mother, you are expected to take care of the baby. So when those three roles collide, that's what we call what? Role conflicts.
Please,
No,
the one who's let them mute the first one.
yeah, I think there is someone. Let's have one meeting.
Yes.
Roles stains, then the role stain happens. You know, with the role stain, there is a role conflict when like a major, like those are two different status conflicting, like the position of being a student and a position of being a mother and a position of being a guild president. Those are big. But in role stain, it narrows deeper to a single role. For instance, a single role of attending my lecture, like you are supposed to attend a lecture as a student. At the same time, as a student, what are like your roles which you are supposed to perform as a student? You are supposed to attend a lecture as a student. And then you are supposed also to read as a student. So when those two roles tend to conflict, for instance, you are supposed to attend my lecture and at the same time you are expected to read, that's where we call what? Role strain. The role strain is more within a single status, but a role conflict occurs in two different status. Remember, as you have different status. You are a medical student, at the same time a daughter to someone. So when the role between being played by a daughter and a student conflicts, that's role stain. But when all the role conflicts within your role as a student conflict within the position of a student conflict, like a student attending lecture and reading, it goes to role strain. You should be able to what? Know the difference. I gave an example. As a student, you have ever been frustrated with your professor because you followed their instruction to the letter, but still you failed to earn the points because you did not get what? Deeper. Yeah, then basically when we talked of what sick role is, it's a term used in medical sociology regarding sickness. In the sick role, understand two major things: the rights and the what? The obligations. Understand what? The rights and what? The obligation. Understand the rights and the obligation. If you tend to understand the rights and the obligation, you are done with everyone, with all the course, all the content in. This rights and obligation was created by an American sociologist in 1951. He's called Person. He was a functional sociologist who argued that being sick, when you are sick, you enter to a certain roles which are what? Sanctioned by deviants. There are sanctions, which means you are not allowed to perform. You are not allowed to perform certain functions. Persons show that sick role has a form of deviant. You are going against society expectation. When you become sick, you move against societal expectation. You are exempt from doing certain roles. The condition of being sick makes you unable to perform certain tasks or carry out certain duties for jobs. So that's why you are granted those rights and obligations. When you see the slides, it's like if a person is sick, he's not able to carry out his or her usual duties such as work at the job, go to school, care for the family members. This is deviant from the normal, the usual positive. So sick role involves behavioral changes, which including the increased attention to your body, daily function, regression, or increased dependence in dependent behavior. When people are sick, they often tend to depend on others. Even your interests tend to what? Go down. For deviant to be sanctioned, a medical expert such as a doctor must satisfy like the person is really here. The person is sick, a process of making it legitimate. So in general, there are only two rights and two obligations. I want you people, by the end of these sessions, you should be able to understand the two rights and the two obligations. So the first right is a person is exempt from normal social roles. A person is exempt from normal social roles. The person is exempt from normal social roles. For instance, as a student, when you are sick, you are allowed not to you are allowed not to attend lectures. You are allowed to miss exam, and they will give you a special exam. That's one of the exemption from normal social roles. And then the right is the sick person is not responsible for their conditions. The sick person is not responsible for their condition.
Oh, no, we started late.
You sure?
Started at 2:30.
So it's 15 minutes into the
You see, the link was sent us to 21.
Single meeting. I don't want to mute you because my network is poor here. So I want to know what's taking place that side if you're getting me.
Whoever is the host should mute the guys joining.
I wanted like to know what's taking place.
There are some people who
Even Elijah Bulega and company, please mute
don't mute their
yourself.
microphones, Doctor. They're the ones that organize that.
No, I think these people there.
Members, just go to the participants, and if you are the host, mute those guys. Or make someone
Elijah.
Yes, doctor, they are muted now. Sorry for that. Doctor, I can continue.
Are you hearing me?
Yes, we are hearing you, doctor.
Eh? Are you getting me?
Yes, we are getting you, doctor.
Okay. So the sick, I was talking of two rights and two obligations. Those are the core assumptions of a theory. When you're dealing with any theory, you need to know the assumptions. So those are the two assumptions, the rights and the obligations. And then in the rights, there are two rights, and then we also have two obligations. And I was telling you people, a sick person is exempted from performing normal roles. I gave you an example of when a student is sick, is exempted from attending lectures, can be exempted from sitting for a paper and given what? A special exam. Then also we have the person is not responsible for the condition. So you don't need to blame them. You don't need to blame them. For instance, when a person gets like COVID or a mental health disorder, you don't need to say you are responsible for your condition. Especially, for instance, the substance abuser, people acquiring HIV, they don't have to, they have those rights. They are not responsible for their condition of being sick. Then when we see the obligations, the obligation we have, if a sick person as a student, because I've already exempted you from attending lectures, you should not sit there that the lecturer, Mr. Akena, said I can't attend lectures because I'm sick. You don't try to get better. Upon exemption, your obligation is to seek technical competent help and cooperate with the medical profession. You are supposed to do those. Then also you try to get better. In trying to get better, how? That's also an obligation. One, seek competent help and cooperate with the health worker. Then two, try to get better. People, when they're sick, some want to play that sick role. They don't want to move from that role. They want to, you tell them to take the medication. They can seek help from a competent health worker, prescribe the medication, but if it's not trying to get better by taking the drugs, following the doctor's advice, you don't do, in trying to get better, you don't do the opposite of what? Of what the doctor has said. So the criticism, Any theory that you really find it has its loopholes. It has its loopholes. So in the loopholes for this theory is that when people they believe, like, this theory assumes that the individual voluntarily accepts sick role. An individual may comply with all expectation of the sick role and may not give up the individual may not comply. Some people, when they're sick, some students, when they're sick, you receive them in the lecture room, yet which makes the theories has some loopholes. Then also individual may accept passive patient role, They don't want to engage fully, to get fully in the patient's role. Then we have this theory fits the model of acute illness. Measles, some conditions, long-term permanent condition, the permanent condition like cancer. The theory does not fit chronic long-term condition like cancer, where getting well not unexpected with chronic conditions such as diabetes doesn't work. Diabetes, cancers, those life-threatening conditions. So this theory is also less appropriate and less functional for both for chronic illness. So chronic patients are often encouraged to be independent. You don't need to, because for instance, if I exempt you from working, that you have diabetes means you'll no longer work for the rest of your life. That's something which is permanent. You need to learn to live with it. Even condition like visual impairment, you can still accomplish. So this theory doesn't work with those conditions. So what I try to the theory may exist between role conflicts may exist between the sick role and the worker's role in this situation. That's what I try to explain about. When you become sick, sometimes the worker may demand you, and also your condition wants you to stay at home. So this is one of the example. So the implication of the sick role assumption: a patient has a right not to be blamed for his illness. Right to be given some leave away by others in regards to normal obligation. That's responsibility to make in getting well. Then they should be accountable when granted sick leave. They should present the evidence, the medical treatment. And then also they should take the responsibility of seeking appropriate treatment for his condition and cooperate and comply with the medical advice. I think that's the end of the slide, but send me questions on whatever you want. You didn't understand. You sent me on the chat, and you try to respond. Send a chat.
Doctor, my question is, sick role and illness behavior, like when you have or
Because, and then
after finishing
did you get about the rights and obligations, the two rights and obligations?
Yes. We stopped
Okay,
hearing you when you the slide and you told us to post questions in the group.
Okay. I'm in the group, so you can write the question. The internet is unstable.
The questions are in the chat.
Yeah, yeah, I've seen some. Maybe I repeat again if you didn't hear. What's the difference between role conflict? I'm starting with this one. What's the difference between role conflict and role strain? Role conflicts, remember, there is this roles attached to a particular status. When you talk of role conflicts, is when one role, for instance, one role from being a lecturer and one role of being a father conflicts with each other. But when we talk of role strain, is when you role as a lecturer, because they are different. For instance, the role of a lecturer, there are so many. So within those many roles of a lecturer conflicts with one another, it's called the role strain. But for the role conflict to occur, it's between two different positions. Because in life, you occupy too many positions. For instance, you are a medical student, you are someone's son, you are a boyfriend or a girlfriend to someone, you are a cousin, sister to someone. So when those roles conflict with one another, for instance, a role of being a medical student and a role of being a daughter to someone conflict, it becomes role conflict. But if a role of being a student conflict with another one, I gave you an example of a role of reading a lecture, reading notes and attending lectures. You want to read, you want to perform your roles of like reading the notes, and then you want to also attend the lecture. Those are, when it collides at the same time, it becomes role strain. I hope that is clear. Then, yeah, actually, then below Shakira said, like, I think role conflict, we have two status conflicting. Then role strain, it's one. So Shakira has given you Shakira is very, very correct. Then someone asked me, if the patient is just responsible for their sickness, then who is responsible? TB. You don't blame someone. Of course, they put those things because some people tend to blame. For instance, are you responsible if you acquire COVID? Are you responsible for it? You didn't create COVID. COVID found you here in 2019. So no one is responsible for that. Then the recorder say, I think I need an example to understand it. I don't know in which In which section?
You
What
have
is
given
the
example,
illness
doctor.
behavior? I've given the example.
Yes, it's now clear. Thank you.
Okay. Then what is illness behavior and how is it related, relevant to psychiatry, and what makes it a psychiatric disease? Illness behavior is not a disease. It just, you should know it's not a disease because it's not a disease, illness behavior. But it tries to explain to you that when you're working with people, it goes beyond treatment. This goes beyond treatment. It tries to illustrate you, when you're working with people, you should understand that when someone is sick, they have rights to be exempt from performing certain tasks. That's why sometimes you complain of this lecturer, even if you tell him I'm sick, will not listen to you, what. Because the whole issue is when you're sick, someone should understand you. And then you're saying, how is it related to psychiatry? For instance, you are a very sick student, you have been sick, we have exam, and the rest you are not able to sit for the paper, and you never start for the paper, and we say, no, we are not giving you, and yet we are not giving you any special paper. How do you think it will affect your mental health? It will be really a disaster for people's health, because it's the relevancy to psychiatry. It makes you understand how, when you're working, how to treat people who are sick, how to deal with some people who pretend, because in the sick role theory, it tries to prevent people from pretending to be sick, people who just pretend to be sick, so in order not to worsen their condition. Then the same question still the same person asked, what is illness behavior? When we talked of illness behaviors are, it's like a state demonstrated by someone when they're sick, what they tend to portray to others, to show to others, becomes the illness behavior. For instance, stopping from work, the sick role is one of the example. Like when you're sick, you play certain roles, so it makes it as a illness behavior. Then Godfrey is saying, if someone takes poison and induce, I'm sick. If someone takes poison and induce an abortion, is she not responsible for her illness? Yeah. If someone takes poison, and induce an abortion, is she not responsible? What about you, Zapiat? Let's first wait a bit. Okay, I think it's back. What about, she's not responsible because she accessed the drugs from you, from someone. She might be responsible in some way, but you don't need to judge them and blame them and make them accountable for their action. It's like then Edison says, if someone takes poison, their intention was to die. So when they don't die, they are responsible. Still, there are things which I don't say they are responsible for taking those poison, because something might have prompted them to do that. prompt them to do that. Because, for instance, you have a psychological distress. So the only best way you think is to die, but you are not responsible. There is something that is pushing you to act like that. I know it's sad, but that's the truth. Then Richard Opoga says incompatible expectations are placed on one person by two roles or more held at the same time. He gave an example of a employed medical student, a full-time employed, and a medical student. Yeah, this is a role conflict. What the example he gave is what? For a role conflict. Now I've been clarifying. Doctor, is illness behavior theory? Is illness behavior a theory or a disease that requires medication? No, it's a theory. You know, a theory is an assumption. A theory is like a statement that that is laid down to guide you in your practice. Then, can someone say, are there more questions? It's there and we didn't. I'm not seeing anything which we might have not. Then still Opoka is saying, when a person, Rolstein is when a person has difficulty meeting his responsibility of a particular role in our oral life. We can say, you can say, instead of using a particular role, you can say a particular status, which is a status, which is a single status, a single one. Yeah, the example, your status is a student who is critically ill and is expected to do an exam. That is that's why the rights, the obligations are there. That's why there is an obligation. The obligation compels you from pretending to be sick, because they're trying to say you must prove it. You must have a medical treatment records, and you must be trying to get better. That's why you end up, when you miss the exam, you either go for, you present your medical form, or some of you are sent for assessment, even to find whether you're fit to sit for the next paper or not. And then maybe what I can say lastly is in exam, I think I'll be able to set about this sick role. So you should be able to, I hope you are noting it down. You should be able to understand the rights and the obligation and the relevancy and those small concepts. The next presentation, I'll just talk like for 10 minutes. Doesn't need, I'm not going, because we did it last semester. I don't know whether I'm going to ask Maraka if we have the notes. It's about the social consequence of mental illness. The social consequence of mental illness, which social consequence of mental illness. One of the social consequences we have the economic. You have the economic consequence. I hope you are noting them down. We have the economic consequence, where in the economic consequence, mental illness has a burden which increases. The economic consequence includes like the cost of meeting the medical expense. You know, when someone is mentally sick, some of the drugs are very expensive. Still, they also tend to access to employment becomes difficult to them. They cannot really easily access employment, so it makes the living condition very not okay. Have the most the internet has gone. I think the internet has it's back. Are you getting me? Let me send in the chat.
Getting you very well.
Okay. The network has disappeared from this side, so I thought, I don't know. So this is what we are discussing. I was talking of economic consequence. Economic what? Consequence. Economic and economic, I was talking of getting access to employment is difficult for them. We talked of the cost of medication brings that implication. The excessive expenditure for some patients. For instance, if someone can be very rich, but because of the mental health condition, might end up mismanaging his finances, and he ends up becoming very poor. For instance, if someone suffers from a bipolar patient, can suddenly donates all his money and no one will really care about it. And then I'm talking distortion of the belief system, right? Distortion of the belief system, distortion of the belief system. Belief system. People with the mental illness as the implication, it always disaltered the beliefs of someone. So when people's belief is altered, their social life is often affected. So that could be one of the consequences. I hope someone will take for us one of an example of someone with an altered belief system and how it affects their life. Then we have relationship. The mental illness also affects relationship. Conflicts within families is often, for instance, someone becomes aggressive, or if someone is also with a low mood, all those have what implication on what implication on life of people. And then trust. also, mental illness often issues always have trust issues. So when they're having often what affected, so the social life in that area is limited. Then another social consequence is the emotions distortion. Emotional distortion. Still, this dimension of life of our emotion often affects our social life. You know, when you have emotional issues, your social life is often what affected in one way or another. So basically, those are the social consequence. These are the four major ones which you can really try to think about. Then I think in the last semester we had that discussion in. We had that discussion in. I don't know whether I gave you people the notes. If the notes is not there, then I'll also send. So basically, this is what we have for today. So is there any question for the social consequence, and we call it a day? Send me in the chat. Yeah, hello. Hello.
Doctor.
Yes. Are you getting me?
Yes, we are getting you.
Yeah. I'm saying, is there any question for me because you are coming to an end?
I don't think so.
Okay. Just for this semester, you just focus on the two. What I'm going to do, I'm going to send the notes to you in your mail. Then what about the first group? Is it called? Oh, there was someone who was the leader for the first group. I want the group leaders. You sent me their contacts, and then I sent to all the group leaders.
Okay.
Okay,
But
nice. Okay.
But right now we are one group.
Okay, then no problem. I can send to you. Then the rest will get.
Okay, doctor. Thank you.
Yeah, thank you so much, doctor.
Yeah, because I saw around. Yeah, how many in the class? I saw around 50.
We are
70 something. 80, 90.
We are 92.
Yeah, I saw 50 something appeared. Okay, nice day.
Nice day, doctor.
Okay.
Mbarara, some people